Hello everyone. Now today's CME is about enteric duplication cyst. Now this was a case which came to us. It was a male child. It was a 3-year-old child who presented with just recurrent abdominal pain. There was no other symptom. And when we kept the probe, now just look at the picture. When we kept the probe abdominally, what did we see? We just saw the bladder and we saw a big cystic mass next to the bladder. And it was in close relation to the bowel areas. So that was the first thing that gave us suspicion that this could be an enteric duplication cyst. But yes, other features also came to our mind that maybe it is an omental or a mesenteric cyst. Now, the second thing that we did was to place a linear probe immediately over this area. And when we placed the linear probe, what did we notice? Let us see here. On placing the linear probe, we could see that this area had a double layering. No, the cyst had a double layering. And what was the double layering showing you? The inner area was hyperechoic, the inner wall was hyperechoic, which is the gut mucosa, and outer one was hypoechoic of the muscularis propria, that is the smooth muscle area of the gut. Now, we all know that in the gut signature sign, we see 5 layers, but most of the time it is very difficult to see 5 layers in the enteric duplication cyst, or even otherwise also it is not easy to see 5 layers of the gut during our routine sonography when we are looking at the GI. So basically the most common thing that you will come across would be a double layered appearance. Some cases you may be able to see 3 or 4 layers, and if you are able to see all the 5 layers of the gut, then you can be almost 100% sure that this is the enteric duplication cyst and nothing else. However, even these two features are sufficient enough to give you a diagnosis of enteric duplication cyst. So one was double layering, and second feature is called the Y sign. Now what is the Y sign? See, I can see the normal bowel area here, and I can see that this wall of the normal bowel area is going into the wall of this. It is bit protruding into the wall of the cyst also. I can see a Y shape being formed, which tells me that it shares a common wall with this gut loop. So this again confirms my diagnosis of enteric duplication cyst. Third thing that can help you is put the probe there and hold it for some time. What you will notice that because of peristaltic activity, the shape of the cyst will change. And once the shape changes, it becomes all the more confirmatory. So concluding, what are the ultrasonography features of enteric duplication cyst? First thing, you will find a cystic area, anechoic area, because we are talking about uncomplicated right now. Obviously, if hemorrhage or infection or something will occur, then this area may get filled in with echos. So cystic anechoic area, usually seen in childhood, close to the GIT, and then when we see it with high resolution probe, we may or look at the wall carefully. You can even do it by zooming, but I would prefer a high resolution probe. I can see double layering or multi-layering of the wall. That adds to my points. And the third point that adds on, that I see a Y-shaped connection with the gut loop, nearby gut loop. I can see the wall of the gut continuing into the wall of the cyst like a Y. This also will look better with the linear probe. And then peristalsis. How will I judge peristalsis? I will have to be patient, wait for some time, look at the cystic area. I may find that it changes shape, right? Like this case, you can make out that multiple layers are seen. So it was because we've used the linear probe. So now you can see there are multiple layers more easily seen. And again, the Y sign we can see there is continuity of the gut wall with the cyst wall, continuity of the layers with the cyst wall. So both the signs we can make out, and change in shape, obviously you will have to be patient and you have to see a dynamic picture to know about the change in shape. So this is all about enteric duplication cyst. I hope it will be useful for you and helpful. Thank you so much.